some cases we have to muzzle these dogs just because they get so scared. This dog right here, Jezebel, she's a little fearful of us, so I'm just going to go ahead and put her muzzle on.
And I'm like this far away from her, so she's quiet.
Put it behind her ears. Make sure it's secure. Here's your muzzle. Okay, so here we have Fletcher. Obviously, you can see he's not very harmful to us right now, but I'm going to be demonstrating how to restrain with a rabies pole. Fletcher. Alright, so for this rabies pole, all you have to do is just slip it over their heads and pull back onto the loop so it makes a collar. So if a dog is harmful to us or is endangering itself, we can use this pole to keep the distance from us to them. So in order to release this pole, you just pull up and give a slap, and you can take the dog out of the restraint pole. Okay, so we have Baxter here, and I'm just going to show you another form of restraint that we do. Whenever we put them down for just gas procedures, we normally just wrap them up in a towel. So, you see it, buddy? Good boy. So what we do, we just kind of wrap one side, wrap the other, and then wrap the front to cover the front feet. So whenever they go through their excitement stages, they won't harm themselves or us. So this is one of those restraints that we do with the towel.
Good.
Okay, so this is Fletcher. We're going to be doing catheter on him today. So I'm going to go ahead and start out, and we're going to clean him up a little bit.
Oh no, you're okay. I know, sweetheart. You're a boy. This is not like your other surgery. You're okay.
Alright, so I'm going to be treating penis. Okay. I'm going to be taking my sterile catheter, picking it up.
You're okay, baby. You're okay, good boy.
To get into the bladder.
You're a good boy. Yes. You're okay.
And we get urine.
He's a good boy.
Okay, so this is Miss Lily. We're going to try to collect a free catch urine sample on her today. Whenever you do the free catch, you would like to let a little bit of urine flow out first, and then try to catch the urine that comes out after that. So that's going to be part of our void free catch. So let me see if I can't get some urine from her. Come on, Miss Lily. You good people, honey? Howdy, son. Howdy. Howdy. Good girl. And it's a little bloody, so I'm glad we caught some urine. Okay, so this is Punk, and right now he's under anesthesia. So I'm going to be getting a cystocentesis off of him today. So I'm going to be checking for a bladder. He has a pretty good sized bladder right now. Okay. Alright, so I'm just going to kind of cup it in my fingers right here. And I'm just going to go in and just pull out. And we never want to redirect when we're doing a cystocentesis, and because we don't want to tear the bladder. If you don't get a sample the first time, you just need to pull out and redirect going back in. So whenever we do the cystocentesis, we're just going to collect a urine sample and start our tests.
Okay.
Okay, so this is Rascal. We're going to do an anal gland expression on him today. He's coming in for a recheck. So to express the anal glands, a lot of the times bathers and groomers do them externally. So they will push up and squeeze. So but today, since we're rechecking his anal glands, we're going to go ahead and do them internally. So I'm going to get some lube, spread it on my fingers. I'm going to slowly enter the rectum. And the anal sac should be somewhere around 4 and 8. Get them till they are all squeezed out. And that looks like pretty normal material. So that is how we do our anal sac expressions.
Go.
Okay, so this is Oakley, and I'm going to be demonstrating and explaining how to do a nail trim on him. Alright, so as you can see, he's got black toenails. So what I'm going to do, I'm going to be taking back a little bit at a time until I reach the quick. Alright, so if you can see this part right here, this black part, I'm going to be stopping right here because that's the quick. And if I go any further, I'm going to make him bleed. He would not appreciate that. So this is how we do nail trims on dogs.
It's safe that
Okay, so I'm going to be doing a nail trim on an anesthetized cat. So cats have, most of them have clear nails, so as you can see the quick is right there. So I'll just be taking off the tip, just like that. Make sure you're not hitting the quick. You gotta push their nails out in order to get them fully trimmed. And that's how we trim our cat's toenails. Okay, so I'm going to be demonstrating how to pill a dog. So this is her cranberry pill that she needs to take. So you just open her mouth, draw her bottom jaw back, and place it in the back of her throat. Wait till she swallows, and that's how you pill a dog. Okay, so we're going to show you how to hand pill a cat. So it's fairly similar to a dog. Just take behind their canines, open up their bottom jaw, and check it back to the bottom of their mouth. Scoop their throat, and they swallow.
So getting a lot of pictures today.
Right.
Okay, so this is Miss Lily. We're going to be cleaning out her ears with a cleansing solution and some Positex. She's had a really bad infection for a while, so this is actually looking a lot better than it normally does. So you can see there's been a lot of inflammation. It's alright, honey. Just pour this in there. It's okay. Lift up the penna and squish it around in there. Make sure the cleansing solution gets around really good. I'm going to try to get most of the yeast out with the gauze. She's still really inflamed, so it's kind of hard. Use some Q-tips to get deep down in there. So you can see she still has a lot of infection in her ear canal. Okay. Now that I've got that cleaned out, I'm going to take the Positex and I'm going to place it into her ear canal and administer the medication. And that is how we clean out an ear. Okay, so this is Punk. As you can see, he's under anesthesia right now. So I'm going to be cleaning out his ears. Oh, he's got a little bit of dirty ear just from he has fleas, and so we just want to kind of clean him out, make sure that he doesn't have any ear mites. So whenever we do cat's ears, just want to lift up the penna, pour in a little solution. Make sure you get a nice squish motion or a squish sound. And then we are going to clean out his ears with a Q-tip. Make sure we get most of the debris out. And we don't want to go too far down to puncture the eardrum. His ears really weren't that bad, so we're just going to put some medication into his ears, and then hopefully we'll recheck in 7 days and they'll be all cleared up. So, right, and that's how we clean cat's ears. Okay, so we're going to be administering some topical medication to this puppy. In this case, it's going to be Revolution. Just gave him his vaccines, the Bordetella birds a little bit. So with this medication, and what we'll do, we'll place it at the back of their neck. We'll lift up the fur to put it on the skin directly, so that can get the most absorption. Okay, so I'm going to be putting an esophageal stethoscope in this sedated cat, and I'm just going to be demonstrating how to do that. So we take our stethoscope and we put it down to about his xiphoid process, and we're going to measure it to his mouth. So that's about 24 centimeters. So I'm going to be opening his mouth and placing it down the esophagus to about 24 centimeters. Okay, so this is Tinky. We're going to be doing the pressures in her eyes with the Tonopin today. So, just going to get over her eye. Okay. It's okay, honey. Hang on. Okay, pressure is 86, and then the other eye. And 30. Okay, so this is Tinky. We're going to be doing a fluorescein stain on her today. So what we're going to be doing, this is just normal saline. So we're going to be taking the saline and putting it on our test. Make sure not to get this on you because it will stain. Just a little bit in each eye. Right. And then what we're going to do, once it covers the eye, we're going to be kind of flushing the eye out. I know, honey. I'm going to take the cotton balls and wipe her eye off. Okay. I know, honey. It's okay. Shh. It's alright, honey. Okay. And after this, the doctor will come over and check and see if she has any type of ulcers or the beginning of cataracts or any symptoms like that. Okay, so this is Tinky. So we're going to be doing a Schirmer tear test on her today. So what we do, we just open this on up. And we're going to be bending our little strips right here. Alright, and I'm going to be putting one in each eye, and we're going to wait about 30 seconds. Hang on, honey. It's okay.
15 milliliter syringe.
Now we're going to wait about 30 seconds. And then we're going to wait to see what type of tear production she has. It's alright, baby girl. I'm sorry. It's okay. Almost done. Got about 10 more seconds left. Hang on. Okay. Alright, so I'm going to go ahead and pull it from this eye first. Okay. And it looks here that we have more tear production in the right eye than we do the left eye. And so what we're going to be doing is just going to be timesing 2, and then we'll find out what we need to do so far as medication. Okay, so this is Oakley. We're going to be doing an enema on him today. So what we're going to be starting with, we have our 60 cc syringe. So I'm going to be filling up this bowl with warm water for him. You can do this with soapy water or just regular warm water like I'm doing now. So what I'm going to be doing, just inserting the red catheter tip. I'm going to make sure that it's full of the water before I start. Now I'm going to go ahead and lube. Insert the catheter. And then I'm going to insert the water.
Alright, Griffey.
Okay, so this is Griffey. He's kind of been vomiting and having some diarrhea for the last couple of days, so we're going to be giving him some sub-Q fluids. So how we get the sub-Q fluids is pick up the top part of his scarf right here, make a little tent, and insert the needle inside that tent. And then we'll just go ahead and start his fluids. Okay, so we're going to be doing a modified Robert Jones on this dog. As you can see, I've already placed his stirrups, and so we're going to be placing the top pad on top of his wound. It's just big enough so we don't have to put a second one on there. So I'm going to be wrapping his leg with this gauze. So I'm just going to be taking his leg and make sure that I get up into his shoulder, just because that his wound is so high onto the leg. Just wrapping around the wound. Make sure I don't have any creases.
Still not 100% sure people yet.
Alright, so I'm just going to wrap around twice. Okay, so now I'm going to be taking our cling wrap, and I'm going to be trying to bandage this down as tight as I can, since this is a pretty thick bandage. So I'm going to try to keep my gauze, or my cling wrap, as straight as I can.
Here, Jen, just use this. Oh, you don't have to.
you can see with this type of gauze, this can be a little bit lengthy process with your cleanup. Make sure you get it nice and tight. Should just about do it. We need to keep the cling wrap as flat as you can so we can prevent sores later. Done with that.
Oh.
Okay. So we've gone all the way around with our cling wrap. Raymond, could you hold that for me, please? Alright, so I'm going to go ahead and put our stirrups on.
No, he's just afraid.
Alright, so next we're going to be doing our elasticon to make everything stick together. So I'm going to be going to put, starting from the distal end to the principal. And same with everything else, we need to at least put this 50% of the way on each side. And we don't really need to be putting this tightened down as hard as the cling wrap or the gauze, just because that we've already done that with our cling wrap and gauze. A little sticky towards the end. Get one more round at the top here so he won't slip out of this bandage. next we're going to be adding on our vet wrap to the bottom of his foot so he can get a little bit more traction when he's walking around. We also keep the toes out to make sure that we don't have any swelling, just in case I wrap the gauze a little too tight or the vet wrap too tight. And also whenever we send him home with his owners, they can also check for swelling as well, or they can check for warmth of his toes to make sure that you know, there's no loss of blood flow. All right, so and that completes our modified rubber joints. All right. Okay, so we're going to be doing a modified Robert Jones with a splint on this poor baby. So we've already sutured and stapled his wounds. So I'm going to go ahead and start with the stirrups. These gloves are not cooperating with me. Alright, so with our stirrups, we're just going to attach the tape to one side and the other side to the other. So we have some, so they won't stick together at the end. So we're just going to tape to one side, make sure we don't have any creases to prevent sores. And then we're just going to tape to the other side as well. Okay. We want to leave this out so it doesn't stick to the patient. Alright, so we're going to go ahead and start with our non-adherent Telfa pads. And this looks like it's just about big enough to fit both of the wounds, so I'm just going to place this right here. And then we're going to go ahead and start with our gauze portion. So we're going to start from distal to proximal. Start down here. Needs to be at least 50% over each loop. So since the wound is so tall, I'm going to need to go over his elbow. And reach up into his shoulder. And with the gauze, we're going to do this from proximal to distal. Still wrapping at least 50% over each loop. Make sure that I don't have any kinks or any wrinkles in the gauze, so to prevent sores. So next, we're going to be taking our cling wrap, and we're going to be doing it the opposite way as we did our gauze. So the cling wrap can actually be tightened down really hard just because the amount of gauze that we have on here. So nothing will budge or get loose afterwards when he's crazy and rambunctious later. And same with the cling wrap as with the gauze, we at least need to do about 50% over each loop. Like we do it, still make sure we do it up over the elbow, up onto the shoulder. And leave a little bit of the gauze out. Okay, so now I'm going to be putting the splint on. Alright, so with the splint, I'm just going to make sure that this is going to be just some extra stabilization. So I'm going to be putting it about right here. Make sure that he has a little bit of room up here. So, you know, as I make sure that, you know, it's on correctly and that he has a little bit of room to make sure that it's all nice and snug. So we're going to be taking the cling wrap again. I'm going to be wrapping and still, even with the cling wrap, we need to make sure that it is flush with the bandage so we can prevent sores. Okay, at this point, this is where we can take our stirrups and add them to our bandage. Okay. Just turn them around.
How's it going? All right, so it's time for our elasticon.
So, and I've already pre-rolled this out, so it doesn't have so much tension in it. So we're going to go ahead and wrap our elasticon right here. Okay, and so since that the wound is so high up on his leg, I'm going to go ahead and do one more round of the elasticon to help it stick to him so it won't slide down later. Okay. And then our last is our vet wrap. So we can add a little bit of traction to his feet so he won't be slipping around so much. So I'm going to go ahead and add the vet wrap to the bottom of this. We still need to keep his toes out just in, so whenever we get done, we can check and see if they are swollen or anything like that, just in case I wrap too tightly, and so that the owners can keep checking for the warmth of the toes to make sure that they don't get cold, and also for swelling as well. Alright, so this is how we do our modified Jones with a splint. Okay, so this is Keely, and we're going to be doing kind of a mock pressure bandage on her. Obviously, she's not wounded for any reason. So normally what I'm going to do is do a pressure bandage for a spay that we normally do. So I'm going to go ahead and start her. Keely, come. Stand up. Stand up, baby girl. Keely. Good girl. Alright, so I'm going to go ahead and start out with our non-adherent pads. Oh, what's that? Stand. Stay. And then I'm going to place that along the incision line where that would be. And I'm going to take our gauze.
Miss Daniels is on the phone. She brought Loki in a while back for she had lip issues, but she wanted to tell you guys something about
So I'm going to wrap that 50% over the last wrap. And I'm going to go back over the incision line. We're done. And then I'm going to be taking some vet wrap, and this is where I'm going to be applying some pressure. So with vet wrap, I'm just going to be rolling it fairly tightly to stop the bleeding. Make sure that's secure. And so now we're going to prevent the oozing and prevent the bleeding from happening some more, and then we'll take this off in about 30 minutes to an hour. Okay, so we have here a dog that got into a dog fight, and so we've already assessed his injuries with an open wound. So I'm going to listen to him real quick. We've already dextrometered him, so his heart rate is going to be incredibly slow right now. 30 beads per minute. So he's still really pink. We've taken a look over him, and so far he does not have any other injuries. We've taken an x-ray, and everything looks fairly good on the x-ray. So, so far as triage assessment, he is okay other than his leg. So for his wound, I'm going to go ahead and scrub it. I'm going to go ahead and put some lube around his wound so we don't get any other contaminants into the wound. So when I scrub, I'm just going to go ahead and scrub around the area. Okay. And instead of using alcohol, we're going to use water because that would hurt really bad.
See if she's okay with me doing staying reside today, be sure and also check.
All right. So we would do that probably about 3 or 4 more times, and our Dr. Kendrick is going to be shaving going to be suturing the area to close the wound. So, and that is how we perform our basic triage and first aid wound care. Okay, so we've got Oakley here down for our dental. I'm going to be explaining how we do our dentals today. So we've got my gloves and my mask that we're going to be using. Okay, first we're going to be doing the hand scaling. So for proper hand scaling technique, I'm going to take the little scaler, turn it around, and I'm going to be taking the scaling on his top molar. We're just going to do it this way, and don't ever want to do this. Just pull from the top and down, or pull from the bottom and up. You don't want to actually just scale back and forth. So that's how we do our proper hand scaling. Now for our sonic scaler, you want to make sure that there's always water coming out of this tip because the scaler gets very hot and we don't want to burn their teeth. So for the hand scale or for the sonic scaler, I'm just going to go ahead and make sure that the water is coming out, and it is. So I'm going to take his molar again, and I'm just going to scale with the tip of it, like a pencil. I'm going to make sure to move around the tooth so it doesn't get hot in just one spot. Make sure you get under the gums so they will reattach whenever we're done. Okay. Now that we're using the hand scaler, okay. And then for our polishing, we use this polish. And now for our polisher, we actually use the tip that just does the back and forth motion. We don't actually use the tip that go all the way around just because they catch hair, you know, they spread all kinds of good stuff. So we just use the ones that go back and forth. Now when we polish, we just get a bunch of polish here. And we're trying to get every surface of the tooth. So when we polish, make sure you get every surface of the tooth.
Sorry, I totally just knocked that down.
Okay? And now whenever we flip him, we will do the other side as well. Now at the very end, we'll take this and we'll spray that tooth down. We'll use the air, the water, and then the air at the same time to make sure that we've cleaned off his tooth. And then here's our fluoride. It's just harder to take it off whenever our gloves are wet. So we just take the fluoride, we shake it up a little bit and pour it on. We kind of rub it around, and then we just rub it onto their teeth whenever we are done with the dental. So After all of that, we flip him on the other side and we scale, polish, and fluoride as well. So that is how we do our dentals. Hi, okay, so I'm going to be talking to you about dental care or client education to go home dental care. So whenever we talk to clients about after their dog getting a dental, we talk about doing really good home dental care so they don't have to come in every 6 months or every year for a routine dental cleaning, so they don't accumulate a lot of tartar on their teeth. So when we send the dogs home, we send them home with a little toothbrush kit. It has a little toothbrush right here that you just stick on your finger and some toothpaste to go home with. So whenever we explain this to the clients, we take our little mouth model and we show them that we need to brush on every single surface of the teeth, so they understand how the tartar accumulates and how to get it off if necessary. So after we show them that, we recommend what they should be eating as a diet. We recommend doing a hard food for dogs, especially for dogs, because the harder the food, the more possible it is to break off the tartar that is on the teeth. We don't really recommend soft food for dogs just because it accumulates a lot of the tartar. So a couple of things that we recommend for them to go home with, the CET Aquadent. You can just add this into their water, and a lot of clients like that just because it's easy to do. So we recommend doing this. It helps clean their teeth and keeps the bacteria off their teeth as well. And for dogs that like to chew a lot, we recommend doing the CET chews and the raw hides. So they have that nice chewing action, so they can get the tartar off that way as well. And plus the Chlorhex in the CET chew will help fend away the tartar as well. So these are some of the things that we recommend to our clients for home dental care.